We've got a team of healthcare support workers. They actually go out to the end-of-life patients. They're actually fast-track patients, so they're the patients that are actually the last 3 months of life. They actually go out and do personal care for them, and they also offer support to the friends and families and their carers. I know that they look after the patients like either it's their own mum or their own, dad or their own member of family, and they'll always come back and we'll have a small discussion, and they are 100%.
Nominated the palliative care team just because I think they're such a fantastic team. They've gone through quite a lot recently with changes within the team. They're caring, they're very compassionate, and I just think they epitomise the 60s, the trust values of how they look after end-of-life patients within their own homes. And I'm very proud of them and what they do.
It's basically one big family. We all work together extremely well. There's the clinical leads, there's our NANS service, which are our health cares. We've got a lovely team in the office as well, and we all just kind of work together.
Well, we're a team of 3 of us, so myself, a physiotherapist, we have an occupational therapist and an assistant practitioner, and we look at assessing patients from a point of view of falls risk. So we go out and do a full holistic MDT assessment. Well, we're a relatively new service. We've only been operational for just 2 years now, so from starting up from literally having nothing, just a spec to start with, we've actually built up the service and the clientele and the patients. So we've actually been able to get out there, speak to the GP, speak to lots of other different areas, and actually encourage more patients being referred into the service, so making sure we actually get the appropriate patients referred in.
I nominated the Season Falls team because being part of it and seeing how far we've come since we've moved onto a separate service, we've grown immensely in the amount of patients that we see and in the influence we have on the public as well. We've noticed that patients are coming to us asking questions more, and that they are not they're not coming back round. So we treat them, they can stay on our books for a 6-month period, and we find that when we keep the check on them, they're not coming back round.
It's been wonderful, and it isn't the first time either. I do silly things, and need to get better again, but they've been wonderful, all of them, and there's never any worry about contacting them, when I need help.
I'm proud to work for SSOTP because it gives us the opportunity to actually set up and establish a very well-known and evidence-based service.
Daily basis we assess and treat patients from a range of referrals, from people who've got back pain and go and see the GP, right to people who've had surgeries and knee replacements, even spinal surgery, and guide them through their rehab and try and help them get back to function and engage with their lives properly. We have a lot of barriers that we face in terms of staffing and waiting times, and everyone in the team has taken a proactive approach to seeing extra patients, working overtime hours.
Well, I nominated this team because I feel as though they've just gone above and beyond really. We've done national benchmarking, and it's shown that there's unlikely to be a team that is probably more cost effective than this one. And also they just provide an excellent staff physiotherapy service just to look after the well-being of the trust workforce.
I referred myself because I work at a desk and I'm on the telephone all day, and I had a bad shoulder. Patient care was absolutely excellent. I found it to be the very, very good with you. They listen to you, they respond to what you need as a patient.
I enjoy the dynamics of our team. Everybody is enthusiastic every day, and we all work together to provide, hopefully, exceptional patient care. I think all of the members of the team would be really proud if we won.